The broadcast is now starting. All attendees are in listen-only mode.
Hey, good afternoon, everyone. This is Natalie Matthews from Apt Associates, and we just want to welcome you to today's webinar, the third in our series of HMIS System Admin trainings. Today we're going to spend the next hour and a half talking in depth about the HMIS Data Standards. I'm joined today by a few other folks. You'll be hearing, in addition to me, you'll be hearing from Jeff Ward, also from Apt, during the presentation. And then Chris Pitcher is from the Cloudverse group is on the other side of things, answering questions and serving as a resource advisor as we make our way through the content. And Ashley Muller from Apt is also on the line to answer any questions that you may have during today's webinar. Okay, so if you've not attended one of these sysadmin webinars before, I'm just going to really briefly go over a few things about the webinars themselves and what HUD's trying to accomplish with these webinars. So this series of webinars is really directed primarily towards HMIS System Administrators, but it's also can be some very useful content for HMIS end users, for staff who may represent the continuum of care, and for any other local partners who are involved in HMIS in any way. The hope, though, is that at the very least we provide HMIS system administrators with the most up-to-date and current information that they need to best implement the system. So, as I mentioned just a couple of seconds ago, today we're going to talk about the HMIS Data Standards. Okay, so we're, again, hoping to get through all this in 90 minutes or less. We realize it's a Friday afternoon, so it's, there's many things going on as we try to wrap up the week, but we're going to devote the next at least hour to 90 minutes talking about the HMIS Data Standards. All of you should be on mute right now since we are expecting a couple hundred people to participate. So if you do, however, have any questions during the course of the webinar, there is a way for you to ask them via GoToMeeting or GoToWebinar. So if something comes up and you either can't hear Jeff or I when we're talking, or can't see the content, or if you have a content-related question that you'd like to ask during the course of the webinar, you can do that by the chat function or the Ask a Question function, I believe, that you'll see on GoToMeeting. And again, Chris and Ashley are both there to ensure that these questions get answered as best possible during the webinar. If, however, we are not able to provide you with an answer to your question during the webinar, either because it's something that requires a policy decision to be made at HUD, or we're simply not able to fully respond to it given the number of folks that are participating today, please be sure to go to hmis.info. And through the Ask the Expert function, you can ask a question of us that way as well. If you have several questions related to the content, it's suggested that you ask on HMIS.info just one single submission, and that you reference the name of today's training, which is just HMIS 101 and Module 3, just so that we know what to connect the content to. Okay, we are going to do, as we always do, we're going to send a follow-up survey after the webinar. It should be emailed out within the next couple days after the webinar, just asking for your feedback about how today's webinar went. We want to know if the information was useful. We want to know how the training went, and it's really important for us to get that feedback because it really does help guide our decision-making process in terms of what content we deliver when we meet again. The webinar is being recorded today. We do apologize. The first module that we did was unable to be successfully recorded, so that audio is not available, but the PowerPoint presentation is for our first module. The second module, there were some initial problems with the audio. It was not able to be viewed or heard, I guess I should say, on HMIS.info, but that's since been reposted, and we thank you guys for letting us know that there was a problem with that. So, again, we'll post today's audio and presentation as well. And one thing that we're going to do a little differently today is during the course of the webinar itself, we're going to ask a few questions of you. We're going to do this by soliciting a poll during the course of the webinar and asking, I think it's about 5 or 6 different polls that we're going to have just to ask you questions that are related to the content that we cover. So this will be one way for us to make sure that we are communicating what we intend to and that we're doing so correctly. So be on the lookout for those poll questions during the course of the webinar. All right, and just on the screen right now are the next topics that we have lined up. The next module is security and privacy. We did have governance on there originally, but we're instead going to focus just on security and privacy. And then there are several more sessions that we'll be doing throughout the course of the year. We did schedule the 101s rather close together. We're doing 2 trainings this month, another one next month. So we're likely going to, as the year goes on and as we get into the holidays and as we get into point-in-time counts or AHAR and other things that you at the community level may be engaged with, we're likely going to start doing these on a less frequent basis and instead offer them on a quarterly basis. So we'll do our best to make sure that what we're presenting is timely and that it's still frequent enough to be connected to the work that you're doing. So you can always reach the TA staff through those help desks, and if you've got new staff that come in or want to review the content that we cover at any time, again, we're recording all of these and posting the content on HMIS.info. Okay, so our first poll is, what is your role with HMIS? We just want to get a quick sense of who is on the line with us right now. So you can go ahead and answer the question. You should see this pop up on your screen right now, a little question that asks you to select one of those roles. Okay. Just going to wait a few more seconds. It looks like almost everyone has voted. There's still votes coming in. Okay, so poll's now closed. All right, it looks as though, not surprisingly, more than 2/3, or just about 2/3 of everyone here on the line is an HMIS System Administrator. And then everyone else, it looks as though there's about 9% among the various other roles that we have listed on here. So we do have a mix of folks on the line, but it does seem that pretty much everyone, as expected, is an HMIS sysadmin. So that's good. Okay, so before we get into the content of the data standards, we're going to broadly present a few slides that broadly discuss why we have HMIS data standards and what those are. So if you are brand new to HMIS, or if it's been a while since you've looked at the HMIS data standards, hopefully this will be a very quick refresher of what exactly we're talking about here. So HMIS data standards were developed by, it says right on here, a consensus process. So there were several key stakeholders that are involved in coming up with what the data and the technical standards should be. The first set of standards were published in 2004, in July of 2004. And as many of you know, in 2010, a revised version of the data standards was published. And so the technical standards that deal with things like privacy and security have not been adjusted since 2004. Although it is likely with the revisions that are undergoing to standards right now that those will change. So currently, the March 2010 HMIS data standards are what remain in effect, or what are in effect, excuse me, for data collection. And then the 2004 technical standards, so everything dealing with privacy and security, remain in effect. The real purpose behind having data standards is primarily to ensure that all of the, the hundreds of continuums of care and the thousands of agencies within that continuum of care that receive HUD funding are collecting data in the same way and at the same times that they're required to. So we want to make sure that since we've got this homeless management information system, since we know that we're going to be collecting data on homeless individuals and families, the primary reason for these standards is to make sure that we're doing so in the same way. So that is a very quick synopsis of what we're talking about here. Okay. So a brief little bit more about the history of the data standards. So what the data standards don't do is they don't require communities to use a specific type of software, or specific software product. There are several different HMIS softwares out there, and all of whom are supposed to be in compliance with those HMIS data and technical standards. Standards also don't limit a COC or an HMIS from requiring the collection of additional data elements. One caveat or one addition that I do want to make to that statement, though, is that if you as a community or an HMIS software decide to collect any data that goes above and beyond the HUD data elements, or if you choose to, for instance, add a reporting category to something because you feel as though it's more reflective of your community, anything that goes beyond the required reporting categories, and again, we'll go over the data elements in depth, but if you decide, as an example, to add a different type of race or to add an other to race, and that's something that's not included in the March 2010 data standards, then it's going to be up to you as the vendor or the community to make sure that you know and you've decided on a way to map that data that's not HUD required to what the HUD required reporting categories are when it comes time to produce something like the annual performance report or any of the other HUD required reporting that you do. So again, HMIS can do a lot. They're systems that are meant to ensure that communities can collect what type of data they want. However, since we're talking about a national standard, and this is one set of national data collecting requirements and reporting requirements, it's just a caution that I'll throw out there to make sure before you go above and beyond or before you start tweaking with those HUD required reporting categories, make sure that you know how you're going to make it map to what is required when it comes time to run those reports. Okay, so again, there's much more that you can do outside of these data and technical standards, but these are meant to be the national standard for what data is must be collected in HMIS. So you can always add more, but if you do, just make sure you know how you're going to report out on it. Okay, and the last bullet on here states that the data standards are not static. They are updated periodically. It's important for you to know when these updates happen, and for you, if you're a sysadmin, to make sure that your vendor's in line with those updates. So please make sure that you're signed up for the HUD listservs that are posted on the HUD HRE website, and that you regularly review and know what the data standards currently say. It's not infrequent that I look at the data standards. I happen to have a copy printed out at my desk so that if I have a question or if I'm trying to answer a question about what HUD requires via those standards, they're close by. So please make sure that you're familiar with those standards, and again, we'll do our very best today to go over all that those standards do include. Okay, when we're talking about the HMIS data standards, we are talking about 3 distinct data element categories in the March 2010 HMIS data standards. The program descriptor data elements were a brand new category in 2010 that were added. The universal data elements are another reporting category, or data element category, and then lastly we have the program-specific data elements. Each one of those sets or types or categories of standards lay out what data must be collected, what the response categories are for those various data elements, and the frequency by which you need to collect those data. Also, one thing that you'll find throughout the data standards when you're looking at those reporting categories are the types of clients, meaning do you need to collect this on adults or children or both? These are pieces of information that you'll find throughout the data standards as you look at them. It's also important to know that not all data in the data standards are required to be collected by every program. So if you are a program that must do an annual performance report or an APR, it's important that you know that you absolutely must collect all program descriptors, all universals, and all program specifics that are required for your type of program. There is a chart that is in the beginning of the data standards. I apologize for not having the graphic up, but you'll see throughout the data standards that they tell you which types of programs are required to collect this data. Are only residential programs required to collect it? That's just one example of the type of information that you'll find in this chart. So if you are looking at your data standards as we're talking about them, or if you have a copy close by, I believe it's page 12 that you'll find this chart starting on page 12, and it goes through, again, every single data element, tells you what types of programs need to collect it, how frequently it needs to be collected, and any additional types of information about the data element that's important for you as a sysadmin to know and ensure that the folks that are entering the data know as well. Okay. Right, and it's really your funding source as a grantee and your program type that determine what type of data you're going to need to collect per the standard. All right, so we've got our second poll question up here right now. It is a true or false question, and just kind of wordy, but I'll say it. So the HMIS Data and Technical Standards are a document that outlines the data collection, privacy, and security requirements for collecting data as required by HUD. True or false? Okay, so we'll just allow a few seconds for us to go ahead and answer that question. Okay. So yes, it's true for the 90% that stated that, and for the 10% that may not think that's the purpose for them, or may just I don't know what. But yes, that's absolutely true. All right. So the next question for us is a quick one as well, and a pretty easy one considering we just talked about. And it's asking you how many different types or how many categories of data elements are there? Okay. All right. So 80% of you are absolutely correct. There are three different categories of data elements that we just talked about, and those are the program descriptors, the universals, and the program specific. Okay, so what we're going to do for the remainder of the presentation is we're going to go over each one of those three types of data elements. We're going to show you what those data elements are. We're going to talk about some common issues or concerns or questions that may come up about those various data elements, and provide some examples to illustrate what is meant by those data elements. And again, the data standards are not always a straightforward topic. So if anything that we talk about today spurs a question, please feel free to ask that today by asking a question through the GoToMeeting function. Or if you think of something afterwards or we don't provide a full answer, please be sure to go to HMIS.info and ask a question that way as well. All right, so I'm going to turn it over right now to Jeff, and Jeff's going to walk us through the first category of data elements.
Hello, everybody. I'd like to add my welcome to Natalie's. We're glad that you're sharing part of your Friday afternoon with us going over the data elements, which are the crucial nucleus of an HMIS system. And to start out with, let me just remind you that the book on all of the data elements is the Homeless Management Information System Data Standards Revised Notice, published March 2010. That's available. We have a link at the back of this presentation. You can also go to hmis.info, and on the home page there's another link right on the right-hand side, or you can search it through HUD HRE. But it's critical. You should have a copy of it. If yours is like mine, it is dog-eared. It's simply the source of the information. And would also recommend you have a copy of that on your laptop here so you can search it and refer to it. So that's number one. The section we're talking about today are the program descriptor data elements. And I field some of the questions on data elements. I've not had a lot of questions on the program descriptor, even though they're new this year. They're required to have been in place now for over a year, so your HMIS should already have these set up and properly answered. A lot of the information that comes from this comes through your continuum of care. They're going to be your best friends. A lot of these questions they have been answering for the homeless information chart for years. So it becomes a joint effort. And as each spring, your COC is required to go through and update the HIC chart, the homeless information inventory. It's a good time for you to go through and review the information in your HMIS system. You are required to update that information at least annually. So that's the time to do it. So let's get into the actual program elements and how they work. They establish a hierarchy of programs within an organization in the HMIS, and they uniquely identify organizations and their programs. They also identify whether or not within the electronic HMIS system, programs are organizational names or actual programs that provide direct client services. So we'll talk a little bit about the difference there. On this particular slide, you see the first 5 data elements out of the program descriptors. It includes organization identifier, which is assigned by your HMIS system internally, an organization name, which is the top name. It may be Whoville Homeless Services. Underneath that, a program identifier and program name. Under that organization, you may have a residential emergency shelter program. That would be a program that would have a program name, program identifier. It's important when you talk about names, organization names and program names, that you standardize across, your HMIS across all of your HUD-related data collection, data gathering and reporting. In other words, you want to have the same names used in your HMIS as you do in your HIC chart or your APRs. So make sure that those are common. It really makes things a lot easier. Direct service code identifies if an organization or program directly provides services to clients. And in general, organizations don't provide the direct services. Programs provide the direct services. And as an example, your HMIS system, even though it's a program, it doesn't serve clients directly. As a client would enter a residential or non-residential service program, their data into the HMIS. But the HMIS system itself is not doing direct client contact. You're not providing a direct client to those services. So let's take a look at a graphic that explains this somewhat. And that, you see a red line across the middle. Above that, that's the area where direct services would have an answer of no. It might be in a city of Whoville in this case. It might be one of their city departments that provided, that would oversee different services. Underneath that red line, you see a direct service answer of yes. And that could be a specific program like Hope Haven Transitional Housing or Child Watch Program or maybe employment services. So if you directly deal with the client, it's a direct service response of yes. Let's talk about some of the other program elements. First of all, site information. If you want to bring up the next slide, Natalie. Thank you. Site information. The purpose of this data element is to describe the overall program configuration and, if applicable, the facility where the program provides the majority of its housing or services. In other words, its principal program service site, and there are 5 components. The next slide, we start to break down what those components are and a little bit more information about them. The first item is the program site configuration type, and that breaks it into 3 areas. A single site, which would be just a building providing the services. A single site with multiple buildings where they're located in the same geographic area but would have several buildings, or multiple sites scattered around. Now, if we're talking about site address, you're required to have a street address unless the provider is a victim service provider, in which case you can either list the address of their administrative offices, or if that's closely connected with the location where the services are provided, you could use a P.O. box, something like that. It's important, it's critical on victim service providers that you do not have an address where clients are actually served. And it kind of raises a point, too, we should discuss. By now, I'm sure you're very well aware that we cannot put data about clients that are victims of domestic violence if they are located in a program whose primary mission is to provide services to those victims of domestic violence. What we're collecting in the program descriptor data elements isn't information about clients. It's information about programs. And it's information about those programs, whether they're an HMIS or not, whether they receive any federal grants or not. So, for instance, if you have a rescue mission and that rescue mission receives no federal funding, you still want information about that. They are a provider. They're part of the COC's service area, part of their service program for providing services to individuals that are homeless or to, in some cases, prevent homelessness. So even though you don't necessarily collect information about individuals, or maybe the programs don't participate in HMIS, you still want to collect information about the programs in the program descriptor data elements. One of the things that program descriptor data elements do is collect and provide the information that the COC needs for their annual homeless inventory reporting. And they need everyone that's providing services to the homeless in that COC geographic area to have their information in. If you have mobile or scattered site programs, say you have an outreach program where they have vans that go out and serve homeless where they're located, in that case the address that you would use would be the administrative office of the program. Same thing for scattered sites. You have apartments located around town, you would use the address of the administrative office of that program. The next element out of that is the geocode. Geocode is assigned by HUD. It's a location identifier, and it's used to separate these programs into the areas where they're physically located. Again, scattered sites should record the geocode for the location of the majority of the beds or where the beds are located as of the last HIC update. Now, under site type, we have non-residential services only. Could be a GED program, could be legal service, medical services, something like that. And then 2 types of residential programs. The first would serve both special needs and non-special needs homeless. The third type, residential, special needs only, would be focused on some special needs population. It would be limited to that. You know, I want to remind you again that the program descriptor data elements are collected once at the beginning and then updated annually. So you may well be at the point where it's been a year or so since you've updated your data elements. Now is a good time to review it, to meet with your COC, review their housing inventory chart, and make sure that you have all of the information in your system. I know this seems like a lot, but if you wrap this annual updating process around the point-in-time count process, it'll be a lot easier to manage, and both you and the COC will benefit from that information. Let's talk about bed and unit inventories. Data element 2.7, continuum of care number. This is the number assigned by HUD to your continuum of care. 2.8, program type code, refers to the type of program that you're providing. If you're talking residential, it could be emergency shelter, transitional housing, permanent supportive housing, that sort of thing. But it could also be services-only programs that have no residential component. But that's 2.8, the program type code. When we get into bed and unit inventory information, on the next slide, we break that into several areas. Now, the purpose of this data element is to record inventory information for each residential COC program in order to produce the housing inventory count for the COC. Now, the bed and unit inventory information only applies to programs that selected response 2 or 3. Those are the residential responses in the site type component of the site information data element. In other words, only programs that do not need to complete the bed and unit inventory programs are those that selected non-residential services only of the site type component. And again, this must be updated annually. Now, we're not going to cover all the nuances that determine and categorize beds, but again, the revised notice gives you lots and lots of information on how to define it. If after reviewing that and looking at frequently asked questions, you still have a concern, you always have available the HMIS.info for Ask the Expert, and you will get a response off of that. The components of the bed and units inventory information. First up is the household type. This component has two response values: households without children and households with children. Persons 18 and over are considered adults. Therefore, for a household to meet the criteria for households with children, there must be at least one person 18 and over and one person under 18 who are applying together as a single household. Again, we're not covering in-depth questions on how to record beds and units where the household type fluctuates based on demand. This will be covered under separate guidance. The availability component consists of year-round, seasonal, and overflow. The distinction between these available responses has to do with when the beds are available. If we're talking year-round, well, they're available year-round. There is no date component to it. Seasonal beds are those that are planned to meet seasonal needs for anticipated higher demand, and they have specific start and end dates. A case, for example, would be a cold weather shelter in the northern part of the country. It only opens when temperatures hit a certain point, or would open perhaps 1st of October and go through the end of March, something like that with a date certain. Also, you have overflow beds, and those are beds that are available on an ad hoc or temporary basis as needed in response to demand that exceeds planned capacity. In this case, if you have filled up your regular year-round shelter, if you've used up all of your seasonal demand, so now you have to start opening up offices and hallways to sleep clients, overflow. Bed types. Bed types, I think I skipped over that. The basic bed types are facility-based, where you have actual beds in the physical property of the shelter. Voucher beds, where you have hotel motel vouchers available for individuals where they can take that voucher and go and get overnight shelter. Other would talk about a program that is perhaps run by churches. The churches rotate on housing homeless, and that's not a facility-based, but it is an ongoing program, so that would be other in nature. Bed inventory is a number that represents the total number of beds available for occupancy as of the inventory start date. Again, there's other guidance on the nuances of recording beds in HIC. There just isn't enough time for me to provide all the details. A lot of what we talk about on program descriptor data works very, very closely with the HIC, and HIC becomes a very good source of instructions of definitions of additional information for collecting the information, on how you collect the information, what information is collected. But bed inventory is a number, it's an integer, and it is just simply a count of the beds that are available within the program. Chronic homeless bed only refers to permanent supportive housing. So if you have a permanent supportive housing program and you have certain beds set aside for chronic homelessness, that's where those beds would go. And unit inventory, like bed inventory, is a number that represents the number of units available for occupancy at the time of the inventory start date. When we talk about units, we might be talking about a room that would house a family, might have 2 or 3 beds in that room. It could be but it's opposed to just a dormitory type of situation where you would have beds in an open area. Okay, for inventory start and end dates, this is the date the beds and the units become available for use. Keep in mind, because the bed and unit inventory must now be maintained from a historical point of view in the HMIS, these dates may represent when a change in the number of beds or units occurs. Again, I know that this is raising some questions probably for you, but just keep in mind the capability of the system. Let's say that you have 10 beds in a transitional program, and those beds are available January 1, 2010. Somewhere along the way, you add another 10 beds. It would be, you would upgrade the number of beds available with that new start date. So where you're looking over a span of time, you look historically at the number of beds that are available at any point in time. So if you have increases or decreases, those are made into the HMIS with a start or end date. HMIS participating beds kind of follows the same thing in that you, for instance, in the example we had before, you have a rescue mission, they've got 150 beds that they report to you that are available for an emergency shelter. They do not participate in your HMIS, so you would have 150 beds with 0 HMIS participating beds. If at some point in time they decided to become involved with the HMIS with all 150 beds, you would put a record in that HMIS participation is now 150 beds with a start date when they started. Obviously, if there's no change in that, you wouldn't put an end date in. It would just remain open with a start date. You can't have more HMIS participating beds than you have total beds within a category. So if we're talking about overflow beds, you might have 10 overflow beds. You can't have more than 10 overflow beds in HMIS. You have 150 year-round beds. You can't have more than 150 year-round beds in HMIS for that agency. Program descriptor data element target population. You may be aware that we have 2 types of target populations. We have target population A, which is optional. And even though it's optional, it provides good information to record in the system as a means to track bed utilization and service gaps. Now, even though it's optional, there are some guidelines on how you use it. If your target population was, for instance, single males in households with children, you would only identify that as a target population if at least 3/4 or 75% of the clients served in that program meet that target population. So if you don't have 75% or more in any one of these target populations, then you wouldn't be able to use that. The second target population is target population B, and this is required. We show 4 categories: domestic violence, the DV, domestic violence victims, VET for veterans, HIV for persons with HIV or AIDS. Now, this is not only required, but it cannot be blank. So if you have a program and it's not serving one of those 3, domestic violence, VET, or HIV, then you have to enter NA for not applicable. Program method residential program occupancy. This can be kind of confusing. Typically, you are looking at clients, particularly in housing programs, that have an entry and exit date. And while that works very well for most programs, for instance, transitional housing or permanent supportive housing, because of the stability of the population, it doesn't always work well in an emergency shelter where you have a lot of clients, a lot of turnover. You're not sure if they're going to come back or not. They may stay a week. They may be gone for a month, may come back. So there's two alternative methods that you can use. Let me just mention that if your program is required to produce an APR, if APR reporting is required, then you must use program entry and exit. The other two are available, for instance, for an emergency shelter that does not have to produce an APR. They have other funding sources, so an APR is not required. Therefore, they can use one of these optional methods. Why would you use an optional method? Again, it's very difficult to keep track of entry and exit in an emergency shelter that has significant turnover. In many cases, particularly faith-based, they may have enough stability that they provide a bed to an individual, and they can track attendance by whether or not that individual is in that bed. Now, for that to work, they have to assign a bed to a specific individual and restrict that bed to that individual. So if that individual isn't there, the bed is empty. In some situations, this works very, very well. Again, cases where you have a little more stability, you can determine attendance by whether that bed is empty or not. The final model is the service transaction model, and basically that records each night of. Now, why would you do that? Some programs can use scanning technology that when a person comes in for shelter, they're able to scan an ID card. That scanning process checks the individual in and then checks them out the next day. So that scanning process identifies one night of shelter. If they don't show up for 3 days, there's no scan. They show up on the 4th day, they're scanned again. That's another night of shelter. For either bed management or service transaction to work, that information, your HMIS system must be able to aggregate that attendance. They must be able to add those individual nights of shelter together. So over the course of a year, a client might be in and out, or he might be gone for 6 months and come back. At the end of the year, you can determine how many nights they stayed and have a historical record of what nights those were. So we don't see this too much. I suspect we'll see it more as more communities add technology to simplify the process of checking their homeless clients into an emergency program. And that's the biggest application, is emergency shelter. Okay, and we come up on another poll, I believe. No, not yet. Sorry. Can we go back? My mistake. I just wanted to hit the last one. That is the grantee identifier. Grantee identifier is significant in the context of HPRP, where information is tracked based on the grantor, who receives the money and then turns around and grants that to the individual service programmer. So you have to have a method of tracking from your HPRP program back to the source funds, back to the grantor who identified it. It is not uncommon in cities to be receiving HPRP funds from several different grantors, and this is how they identify what services they under each of the different programs. Okay, and now we're up to poll number 4.
Okay, and sorry, Jeff, just to cut in real quick. I guess that for this poll, we don't have it in GoToWebinar, so I guess we can just go over the question and the answers. That's okay? Okay, very good. Well, you can see the questions there. Why do program descriptor data elements really matter? And you have 4 choices. They don't. They're optional. The second choice is they establish a hierarchy of programs within an organization in the HMIS and uniquely identify organizations and their programs. Choice C is they also identify whether or not within the electronic HMIS systems, programs are organizational names only or programs that provide direct services. Fourth choice, both B and C. And the correct answer is both B and C. They establish that hierarchy that identify programs down to actual services to the client, and also allow the identification of direct services to homeless clients.
And Natalie, it's all yours.
All right. Thanks a lot, Jeff. Okay, so now that we've talked about the program descriptor elements, we're going to spend some time talking about the universals, the universal data elements. Just before we get into those, there are a few points I want to make about what distinguishes the universal data elements from the other two types and why this distinction is important. So for the universal data elements, there are only 15 data elements on there. And the reason for that is that when HUD was designing the universal data elements, they were doing so with the idea that these data elements, since they're required of nearly all programs, that these would be required to be answered in settings that are not quite as permanent, if you will, or stable as permanent housing or transitional housing programs. So if you're an emergency shelter program, it's not likely that you're going to be able to collect information, detailed assessment information always on clients. But we don't want to lose not only a solid count of those clients who are served in an emergency shelter or another type of setting, but we also want to make sure that we get some additional not only identifying but descriptive information about those clients. So the 15 data elements that are listed here on the screen are what are required for the universal data elements. And as I just mentioned, these are really critical for the HMIS in general. They really create the baseline of the counts and the baseline of the understanding that we have of who's homeless in our communities. So they're really necessary as well, since the identifying information is in here, such as name, social security number, date of birth. All of this identifying information is used by many HMISs to come up with a personal identification number or to de-identify clients that are in the system. So you've got identifying information, and then you've got the requirement that you, as an HMIS, come up with a unique person identifier and a household identification number. So in addition to providing basic counts and basic demographics or characteristics about clients served in a continua, these universals are also the way that we can help ensure that we've got an unduplicated count of clients as well. So we're going to go through each one of these. Some of these are very straightforward, so we won't spend that much time on them, but for those that are a bit more nuanced, we'll do our best to get through the common concerns or issues that are met with those. So the first one is one of those very straightforward ones, and that's just name. So the HMIS Data Standards require that first, middle, last, and suffix of a client's name are collected. It's best to collect that as soon as possible, so either at program entry or if you're in an emergency shelter setting, perhaps when you're checking clients in for the night. So that is a key piece of information that's collected early on, and that more than likely will not change over the course of the program stay for a client. The other is, or the next is the Social Security number. So the Social Security number is important for some fairly obvious reasons. One of them is that it's really critical to the creation of that unique ID for the client. And another reason that it's important is that depending on how your HMIS is implemented, it can help increase the utilization of mainstream resources. And so what's meant by that is if you happen to have an HMIS that is sharing data with other data systems, and you have the ability to match your HMIS data with other data systems such as the Social Security Administration or the local Department of Social Services or something along those lines. Everyone in the country has got a unique Social Security identifier that really is the way to know who this person is that you're speaking with. So you can use this unique ID not only within your HMIS to ensure that you've got an unduplicated count and that you're creating that unique ID, but also to see if clients may be available for other mainstream services. I don't think that the second point in terms of its importance is utilized across the board. I think it's a fairly advanced use of the Social Security number, but we're just mentioning it because it is one thing that you can do. So it's not a requirement that you match data. It's not a requirement that you're sharing Social Security numbers or anything like that. If anything, there are some very clear requirements in place to make sure that all the data is secure. So again, that example is only meant as a best practice for really advanced communities, I think, that are sort of matching their HMIS data with other systems. Okay, in addition to the actual social security number, you also are now asked in the HMIS Data Standards to report on data quality of that. So you're required to enter if the full social security number, a partial social security number was entered in the system, or if the client does not know or doesn't have a social security number, and lastly, if they refuse. So throughout the data standards, the universals and the program specifics in particular, we're going to see don't know and refused as options for many response categories and for many data elements. So before I go too much farther with those different data elements, I do just want to say a little bit more about what is meant by don't know or refused. It's really important, and I think this comes up particularly for Social Security number, that those that are entering the data or those that are collecting the data at the program level are asking for the information. If the client, after being asked for that information, genuinely doesn't know, then that's when don't know should be entered into HMIS. Or again, if they refuse, that's when refused should be entered. So just want to make sure that everyone understands that the presence of don't know or refuse in the data standards does not mean that folks should be simply checking that off if they're uncomfortable asking a question or if they assume that the answer should be don't know or refuse. So it's critical that these reporting categories are utilized, but they're done so in the way that it's intended, which is to capture when it's genuinely not known or refused by the client. Okay, date of birth is another one that is pretty straightforward, but is also used for the creation of, or for unique identification within an HMIS. So similar to the Social Security number for date of birth, you're also going to be answering in HMIS whether or not a full date of birth was reported or an approximate or a partial date of birth, and you do have the option of saying don't know or refused. And again, since many of these questions are asked in settings that where clients may not be there for very long, it's really critical that this information is a part of your intake process at the program level and that it's being asked as soon as possible. Okay, race is the next one, and we'll see ethnicity on the next slide. And race and ethnicity are now separate data elements in an HMIS. You can see the reporting categories here on the screen for race. We have American Indian or Alaskan Native, Asian, Black or African American, Native Hawaiian or other Pacific Islander, white, and then don't know or refused. A lot of people, understandably so, find these categories somewhat limiting, and it's important that you take a look at the definitions that are provided in the data standards about what is meant by these various race response categories. So please make sure that you're aware, again, if your community or your HMIS has decided to add more options here, that you're aware of how you're going to match that new option that was added to what's listed here on the screen, because when it comes time to run those reports that are required for HUD, they're only going to be for those response categories that are listed on here. So make sure that you know if you're collecting anything different from that, that you know how that data is going to be mapped to those HUD required categories. An important thing to add about this is that the data standards state that it has to be possible for people to select multiple races for a client. So multiracial is not a response category listed here, but you can choose more than one of any of those categories that are listed on here, with the exception, obviously, of don't know or refuse. So you can say that someone is white and black, you can say black and Asian, any of those that are listed on here, again, are appropriate things to respond to in your HMIS. So I think race and ethnicity are perhaps two of the trickiest ones, and it's important that you as a sysadmin understand what's being collected, how it's being asked, because at the end of the day, when it comes time to run those reports, you're likely going to be the person that people are going to go to and say, how do I understand or how do I interpret this data? Okay, ethnicity, we've got non-Hispanic, non-Latino, or Hispanic and Latino as the two options, as well as don't know or refused listed on here. Okay, and again, I just want to make sure that folks understand these are separate data elements. So putting in a response category for ethnicity and not entering anything for race means that you're going to the client will show up as having ethnicity and missing the information for race. So please make sure that people are familiar with what they're supposed to do and that they're answering these as completely as possible. Okay, gender is another reporting category that is part of the universal data elements. The response categories are listed here on the screen. And for those that are a bit more sensitive, for transgendered male to female, transgendered female to male, it's important that your HMIS training includes some guidance to make sure that people know how to ask these questions and how to collect the information. And the folks in the field that are case managers and that are social workers are likely going to be much more comfortable asking these questions than an HMIS sysadmin. So, they may in fact have something to provide us in terms of best practices about how to ask these questions. But again, make sure that all of these options are in the data collection tools and that everyone knows what they can ask and what they are required to ask per the HMIS data standards of clients. Okay, veteran status is another one, and that's simply a yes or a no. But for definition purposes, I just want to be clear that everyone has the same definition of what is meant by the term veteran. So a veteran is someone who has served on active duty in the armed forces of the United States, including the military reserves and the National Guard, if they were called to active duty. Okay, so it's important that everyone understands what is meant by the term veteran. And I'll repeat it again just because it's a little bit more nuanced, but a veteran is someone who has served on active duty in the armed forces of the United States, including military reserves and the National Guard, if they were called to active duty. Okay. Veterans status is one of those data elements that, as we all know, is paid a lot of attention and gets a lot of press in terms of the responses that are given, because there's estimates that 25% or more of the homeless population are veterans. So it's really important that this data is being collected in the same way across the board so that folks really understand what's being asked and what they're giving for responses. All right, we've made our way about halfway through the universals. Okay, and we're going to go over just a few more of them. We've got about 3 or 4 more slides on those universals. So disabling condition is another universal data element, and disabling condition is now collected on all clients that are served. Okay, and that's an important difference from previous data standards in that this information is only collected on adults. So this is an important one for folks to know about, and an important one to know in terms of who it's required of. So disabling conditions now required of all clients served. So adults and children should be asked this information. The next one is residents prior to program entry. Okay, so you've got several different options, and I've listed here on the screen only those that were added, meaning that they were not in the 2004 data standards, but they were added to the 2010. And these represent, again, just some of the new response categories that you'll see on there. We've got VASH, which are housing vouchers for veterans, listed on here. We've got more permanent destinations like a rental or an owned by the client. And then, of course, there are temporary destinations like an emergency shelter or a transitional housing program that are listed as well. So you've got several different options for residents prior to program entry that you are going to be asking your clients as they enter your program. And I think I just misspoke, so I apologize. It's residents prior to program entry that I'm talking about, not destination, even though the response categories are somewhat similar. So when a client is entering a program, you're trying to get an understanding of where they're coming from. So you want to know not only what type of residence, so again, it can be an emergency shelter, transitional housing, or any of the permanent housing locations that are listed here on the screen and that are also in the data standards. We've also got things like jail, prison, hospital. There's about 23 different response categories for residents prior to program entry. So it's fairly inclusive and should represent everything that's on there. If it does not, though, other is an option. So if you try, if someone entering data tries to put a residence in one of those categories and it's just not possible, other is an option as well. And in addition to the type of residence prior to program entry, you're also going to be answering the length of stay in the previous place. So you're going to be entering into HMIS how long they were in that previous location and what type of previous location that was. This one can be a tricky one, just in terms of how it is asked and when it is asked. So to the degree possible, when we're talking about these data elements, if there's any way for you as a sysadmin to make sure that when people are in your system, they're seeing those universal data elements right up front. And again, we mentioned that people and communities can certainly ask more questions if they'd like, but if you don't have your universal data elements, you don't have much in terms of HUD reporting. So it's my recommendation, just based on previous experience, to the degree possible, put those universals up front in your HMIS as much as possible. What I mean by that is just make sure that people are trained to answer these questions first and enter this data first into HMIS, and make sure that you've designed your assessment screens in HMIS in a way so that it's clear to people what's required and what they need to answer. So each HMIS is a little different. Each sysadmin does things a little differently. But to the degree possible that you can, make sure that these universals are front and center and that people know that they have to be answered. Please make sure that you do that. Okay, zip code of last permanent address is another required data element. You're also, in addition to entering the zip code, if it's known, you're going to be entering again, a sort of a quality question about that. So you're going to be saying whether or not that's a full zip code or a partial. And then housing status, which is a data element that was added relatively recently and primarily was first used for HPRP, but it is required as a universal data element. Okay? And this data element also should be asked as soon as possible, and you're going to ask it folks are going to ask it when the client enters, and they're going to enter this information as well at exit, with the exception of emergency shelters. So emergency shelters only need to collect housing status at entry, but at program exit, it is also required that this be entered for residential programs as well. Okay. So there are a few different possible responses that can be given for housing status. HPRP, as we know, is one program that does require this data element and that does use this for eligibility criteria. But again, this is one that is a bit more nuanced in terms of the types of responses that could be given. And so the data standards themselves have a lot of description. It has about 2 paragraphs on each one of these response values, describing what is meant by literally homeless, what is meant by imminently losing their housing, unstably housed, or stably housed. So please make sure that you are familiar with what is meant by all these and that you look at this data with as much frequency as possible. In addition to veteran status, like I said, housing status is another data element that, for HPRP in particular, gets a lot of attention and is used to understand homelessness in a very specific way. So you want to make sure, to the degree possible, that this data makes sense at the local level for you. And one of the best ways to do that is by running data quality reports and by looking at your data as frequently as possible. And if nothing else, if there's a way for you to focus in just on the universal data elements and make sure that the quality is high for those and that you don't have a lot of data missing, or that what's in there doesn't make sense. And you at the local level are going to know that better than anybody else. So again, please look at that as much as possible. All right. And I believe this is the last universal data element that we're going to talk about, and this is the program entry date. Okay, so the program entry date, Jeff mentioned this earlier, so I won't talk in too much depth about that, but if you are a program that is required to run an APR, then you have got to have a program entry date. You can do this in a couple different ways, though, if you are not required to have an APR, and that's the service transaction model. And the service transaction model is what Jeff mentioned earlier. This is an optional data element in the program-specific, So the service transaction model uses the services provided data element that's optional in the program-specific data element. So let me say that again because it came out a little crooked. So the service transaction model, which is listed on here when we're talking about the program entry date. If you're using the service transaction model, this model utilizes the services provided optional data element that's in the program-specific data elements category and records services in the system without a relationship to a program entry and exit date. So as Jeff mentioned, some communities are utilizing a scan point model where they may check clients into a bed and then check them out when they're not in the bed any longer. And that is a perfectly acceptable way to ensure that you've got program entry information as well. Okay, but if you do have to run an APR, then you have to make sure that you've got a program entry and an exit date in that HMIS system. Okay, we have made our way through the universals, and I realize that was done a little quickly. But again, if you have any questions as we're going through things, I know that Chris and Ashley are doing their best to answer them as they come in. And we're going to take a few moments at the end of the presentation just to look at any questions that may be outstanding and talk about anything that's come in. But you can always ask it again afterwards if we are not able to get to it. Okay, our last section of data elements that we're going to talk about are the program specifics. And I am going to turn it right back over to Jeff to walk us through those.
Thanks, Natalie. Just to emphasize, the universal data elements are really the key to producing an AHAR. If you're not currently producing an AHAR, or at least you don't have all of the categories that you'd like to have for your community, a real focus on universal data elements is critical. They'll take care of all your needs for emergency shelter and transitional. For permanent supported housing, there is a request for some additional information from the program-specific data elements. So how do you know what to collect? We've talked about 3 different categories to some degree. Let's talk about program-specific data elements kind of in general, and we'll get into that in a little more detail. Program-specific data elements provide information about the characteristics of clients, the services that are provided, and client outcomes. These data elements must be collected from all clients served by programs that are required to report this information to HUD. Specifically, programs that receive funding through HUD's Supportive Housing Program, Shelter Plus Care, Section 8 Moderate Rehab for Single-Room Occupancy Dwellings, the SRO program, and the homeless programs funded through the Housing Opportunities for Persons with AIDS, which is HOPWA. Programs are required to collect most of this information in order to complete an annual performance report, the APR. Likewise, programs that are funded through the Homeless Prevention and Rapid Rehousing, HPRP, are required to collect some of these data elements in order to submit quarterly and annual performance reports. I would direct you back to the Homeless Management Information Systems Data Standards Revised Notice, March 2010 we talked about. Starting on page 12, there's 5 different exhibits that really help to clarify what must be reported, what kinds of programs, what data elements are reported. It's really a great guide to make sure that you're getting everything in the system that you need to have in the system for the programs that you're dealing with. They really did a great job on putting this together. All right, let's get into the individual elements. Income and sources. In addition to collecting data on income at program entry and exit, income must also be collected and updated annually. If the client stay, that is if the client stay in the program is longer than 365 days. Programs are encouraged to conduct this income update just prior to the close of their APR reporting period, so the information reported is correct and accurate. So that's the frequency: program entry, program exit, annually if they stay in your program for a year or more. The general question asks about income received in the last 30 days. So when they enter, that's the question. First of all, did you receive any income? If the answer is yes, then there's additional information you need to talk about. First of all, if there is earned income, that is income that they earned from a job, then you have to report the dollar amount of that income. Now, some other types of income, other than earned income, such as SSI or Veterans Disability or Workers' Comp, those sorts of things, you have to report a yes or no answer to those questions, whether they receive that or not, but you're not required to put in the dollar amount. Finally, you do have to report under this data element on the total income received. So if they had earned income from a job that they're working, maybe a part-time job, plus some of these other benefits, it all has to be added up so you can come up to $1 amount at the bottom of the standard. Remember, as a general rule, and this does get confusing, and if you get into a spot, I would encourage you to submit a question through HMIS.info through the Ask the Expert section. But as a rule, income is recorded for each client and is assigned to a household member if the income source or amount would leave the household upon the departure of that member. So if it's related to the head of household or an income, that would be assigned to the head of household only. But it may be a program that is a benefit to one of the children, and they would lose that benefit if the child left. Kind of following the same guidelines are the non-cash benefits. Same sort of thing, frequency of collections, program entry, program exit, and annually if they stay more than a year in program. Subject scope for both cash, or rather for the income section, for both income and non-cash benefits, subject scope is all clients. So this even applies to the children. The first general question is, did you receive any non-cash benefits in the last 30 days with a yes or no? If they respond to that, then there's a long list of items that they would click off. Could be Medicare, could be children's health insurance, TANF, those sorts of things that you don't have to calculate a dollar amount for. The next slide talks about a number of disability statuses. And we are talking about 4.3, 4.4, and these all refer to the numbers that are in revised notice. You can see we skipped 4.5. We'll come back to that a little bit, 4.6, 4.7, 4.8. We lumped them all together because they tend to have the same rules. They have to be, the information has to be collected at program entry and exit, and at least annually. Subject scope is all clients. And these also have the additional responses of don't know and refused. And again, to just add to what Natalie said, it doesn't mean that the caseworker doesn't know. It means that the client doesn't know. So the questions have to be asked. And if the client doesn't know or if the client refuses, then you mark those responses. Now, when we look at AHAR, even though these are legitimate responses, they don't produce useful information. So if you have a lot of don't know or refused responses to one of the AHAR categories, we may not be able to use your data, at least describing that specific data element. So keep that in mind. It can make a difference on your AHAR, just on whether or not that line of data can be used or not. On the next slide, we get into 4.5, which is kind of a new concept. And even though this presentation isn't to talk about the changes from 2004 to 2010, I think sometimes it's helpful because these are areas where your end users, your caseworkers, the folks that are going through the intake with the client may still have some questions or concerns, may need some additional help because it's relatively new to them, even if they've been in HMIS for a while. And the chronic health condition is a diagnosed condition that is more than 3 months in duration, either not curable or has residual effects that limit daily living and require some adaptation in function or require special assistance for the client. Some examples of chronic health conditions include heart disease, severe asthma, diabetes, adult onset cognitive impairment, stroke, just to name a few. There's some additional examples in the 2010 notice. On our next slide, we talk about again, we're kind of going back and forth a little bit, but what is really critical here is that these 4 data elements, 4.3, 4.4, 4.5, 4.7, you can only produce a response of yes to these conditions if you have documentation in the case manager's records to support that selection. Now, documentation includes written verification from a state licensed professional, such as a medical service provider or healthcare provider. May include proof of Social Security Administration benefits that they do have a disability and they're receiving a SSDI check or VA disability benefit check. If a client comes in and you feel that they have a physical disability, but you don't have that documentation, you really have no option at that point but to mark it as don't know until documentation is available and documentation is in the caseworker's file. Once that documentation is, then you can change it to a yes at that point. But this one is pretty restrictive as far as what responses you can provide, what the basis of that response is. Let me temper that a little bit, and that is that these 4 items require that that a record be in the caseworker's file, so long as that's a requirement of the funding. Now, if you're producing an APR, then you've got to have the information in the file. If a funder requires that documentation, even if it's a non-HUD funder, but it's a funder that requires it, then you must have that documentation in the file. However, let's say that you're operating an emergency shelter and that shelter does not have a funding requirement that these items be documented, then they could be marked. You can indicate that it's a physical disability or chronic health condition or mental health issue. You are only required to have the documentation in the file if the funder requires that documentation. And normally program-specific data elements are coming because of an APR requirement. So you'll have that requirement through the APR. I think the best rule is to treat them the same, to have that documentation in file. Okay, let's go to the next slide. Some of the other items that are in program-specific data elements is domestic violence. And I'm going to stop for just a minute and restart my computer so I can see what's on the screen here. I'm sorry, it times out, which is one of the privacy and security requirements. All right, so for domestic violence, we had mentioned before that if a person is in a program and that program, the primary mission is to provide services to victims of domestic violence, you cannot have that information in your HMIS. However, you may have clients that are in other programs, and those programs are not dedicated or not limited in their mission to victims of domestic violence. Then you would collect the information on domestic violence. It has to do with whether it occurred, including or refused, and also there's a time element of how recently that domestic violence occurred. We have destination, which is similar to one of the data elements that Natalie discussed in universal data elements. There are 25, I think, if I counted those correctly, 25 different responses to this. Covers everything from a destination as they leave the program of emergency shelter or transitional, through staying or living with a friend, permanent tenure, staying or living with friends, permanent tenure, deceased, don't know, reviews. So it incorporates both the destination and also your best understanding of how long that situation will occur. If you anticipate that they're moving in with family and there's every reason to believe that that is permanent tenure, then you would mark it that way. We have some of the examples here, and as I mentioned, there's quite a few more actually in the standards. So you got lots to choose from. When we get into working with outreach, these could be vans that drive around and try to contact folks that are living outside a shelter, they're living on the streets, they're in an encampment somewhere. They can be very, very difficult to engage. So if you are working with an outreach program, you've got a couple of unique data elements that you're required to collect. First of all, there's a data element of date of contact. And in this case, date of contact refers to the time and the date that you had an intentional meeting with a client. Now, typically when you're trying to address a client that is refusing to come into shelter, doesn't want to come into shelter, it can take a long, long time to build up enough confidence that they'll accept services. So during this period, date of contact requires very limited information because you simply don't have much. Typically, the client will not share much information with you. You do have a response of where the service was provided, whether it was non-residential or residential, and the timestamp allows you to have multiple contacts within a day. So you might intentionally go and meet with someone in the morning. You might go back later in the afternoon and work out an appointment or have some additional contact. But this is not full engagement. 4.12 talks about engagement. And engagement is really the point where there is an interactive client relationship that results in the deliberate client assessment. Assessment is the key word here. The date of engagement is the point at which the client has agreed to participate in an assessment of needs and may agree to accept services such as staying in the emergency tonight. And as a result, the case record is opened. At this point, because an assessment is being done and the client is potentially accepting the service, the client is likely to provide all the universal data elements if they haven't done so already. Once you identify that date of engagement, that the client is accepting those services, then you can no longer use the date of contact. So it's a sequential sort of thing. Date of contact until you can engage that client, you're willing to receive services, you can complete most of the universal data elements. And once you hit that point, then it becomes an engagement. Data element 4.13, financial assistance provided. And we're looking at start and end dates. These are the items that relate to HPRP. So if you've been working with HPRP, these will be very familiar to you. It's about the date that the assistance began, the date it ended, the type of assistance, maybe rental assistance or utility deposits, or utility payments, something like that. Any of a number of services, and these are unique to HPRP. Along with the financial assistance provided, there are housing, relocation, and stabilization services on the next slide, and they follow the same sort of rule. They have a start and end date, and they would include things like case management, housing search and placement, legal services, credit repair, that sort of thing. Now, for both the financial assistance provided and for the housing, the relocation and stabilization services, they're HPRP only required, and they also have to be updated every 3 months. And that's due to the HPRP quarterly requirements and completion of QPRs. And then finally, we have a whole series of optional data elements. And these optional data elements are defined. They're responses in the system, but it's completely up to the community on whether you choose to use any or all of these. They're primarily used to assess how the client progresses over time. So it's a way of looking and measuring how the program has worked, how the client is doing and advancing. So they're very useful tools. Some of the software providers have them, some of them don't. But if you have, if your software is capable of using this sort of information, it can be very valuable in helping your community understand what programs work and how well they work. And that brings us to poll number 5. I don't know if this is up in the system or not. Yeah, it is indeed. So you've got 4 choices on these if you want to weigh in. All right. Hopefully everybody's got their vote in. And you can read the responses here. Annual performance report is the correct answer as a requirement, as part of the way I really started the presentation. Homeless assessment report for emergency shelters and transitional only requires universal data elements. It's interesting, annual progress report is the old terminology for annual performance reports. It's kind of a trick question for you. So I guess about 75% of you got that. Did you put that in, Natalie?
I did. That was an attempt at data standards humor, so yeah.
Yeah, it's hard to find data standards humor. And that completes our program-specific portion of the data standards, and Natalie, it's all yours.
All right, thanks a lot, Jeff. Okay, so we're just going to wrap up with a few more slides to talk a little bit about what's next, and just to reinforce where you can find some great resources to either follow up on the content that we talked about today or to get some new information. So the next webinar is actually next week, and a separate registration is held for that. If you do not have the link for registration, send us an email and let us know. But again, it all went out in the same HUD listserv, so it should have come out at the same time. And I think we've already got quite a few people registered for that webinar as well. The webinar topic that will be covered next week is, again, in-depth security and privacy. And during that webinar, Kat and Jeff are going to walk you through, Kat Freeman and Jeff Ward are going to walk you through some key tips on security and privacy, and are really going to help you understand what the best practices are for that topic. So next week, same time. Okay, and there are several resources that are available. Primarily, there are two websites right now, as most of you may be aware, HMIS.info and the HUD Homelessness Resource Exchange, or HUDHRE.info. So HMIS.info is still the best place for you to get information about HMIS, and that's where the copy and the audio of, today's presentation will be posted. And the Homelessness Resource Exchange has some information about HMIS, but right now is primarily meant to include program information or information that would be most helpful for continuums of care. So both resources are open to you as you're trying to learn more about both HMIS and about HUD and its homeless assistance and homelessness prevention programs. The data standards, we've got a link up there right now for the 2010 data standards for you to make sure that you review. And Jeff and I have both mentioned and owned up to the fact that we absolutely have a copy of those by our desk, and strongly suggest that you do as well. It's a relatively large document and one that is really meant to be and is the main source of information for HUD's data collection requirements. So please be sure that you download that today if you've not already. And the last resource is listed on there. I think we've had that on for the last couple modules that we've done, but I just want to mention it again. It's a data quality plan toolkit. It's a really neat resource that was developed a while ago, and that will help if you do not have data quality tools in place right now. It will help you develop the systems that you need to regularly monitor your HMIS's data quality and ensure that you are up to speed with how best to do that. So those are some resources. I'll leave it there on that screen, and I'll just reinforce again that we will send a quick follow-up survey that we really appreciate you taking a few moments to fill out, and we'll do that within the next couple days. We'll stay online for a couple more minutes if you have any questions, but again, just thank you all very much for taking the time, and talk to you again soon. Thank you.
I do have a correction real quick.
Oh.
And that came in. If you had been following along on the revised data notice, you would have picked it up. And that is, when we talk about contact, we do have a timestamp. But I think our slide indicated that data of engagement also has a timestamp. It does not. So only what the timestamp on it is the contact information. So thanks to whoever caught that.
Thank you. Thank you. You guys are paying attention. All right. Thanks.